Treatment centers cling to a legacy EHR because they fear the switch. But a glitchy, cumbersome system drives more staff dissatisfaction than a migration ever would. The dread of changing systems keeps centers on software that quietly costs them more every day they wait. Whether you call it a transition, a switch, or a migration, changing behavioral health EMRs is one of the most dreaded administrative tasks, easier than you fear. We walk through the 4 reasons organizations procrastinate on leaving a legacy EHR and how a modern platform answers each one. Administrators hold on to negative thinking about the big switch, repeating the same handful of worries year after year. It's so expensive. The transition will go on forever. The last switch cost us so much time. These are the phrases we hear most. Our staff will never forgive us. Our workflow is too complicated. The concerns are legitimate, but there is more than meets the eye. A glitchy, cumbersome legacy EMR can cause more staff dissatisfaction and turnover than a software transition ever does. The system you keep is rarely free. In many cases, the out-of-date, dysfunctional system is itself the source of staff frustration that leadership is trying to avoid. Payers demand more documentation than ever, intake packets keep growing, and lab results drift out of the record into stacks that never get filed. A switch can actually be embraced by staff, especially those who feel burdened by an out-of-date system that gets in their way. One study found that over 67% of clinicians are not happy with their EHR, and over 30% are considering making the switch. In that same study, 30% felt a poor-performing EMR is a leading cause of clinician burnout. Behave Health is an all-in-one cloud platform designed specifically to accommodate the workflows that are unique to behavioral healthcare. So the move off a legacy system is easier. It is designed to simplify every step, from customer resource management to clinical documentation, discharge planning, and the patient portal. We work with you to simplify existing systems, so the transition is designed to be straightforward rather than disruptive. Here are the 4 reasons organizations procrastinate about leaving a legacy EHR, and how a modern platform is designed to answer each one. Workflows, staff morale, cybersecurity, and transition support. The 4 worries that keep centers stuck. Let us take them one at a time. Reason 1. The fear that idiosyncratic, evolved workflows make a transition too hard. It is important to clean up any unwieldy workflows before attempting to transition to a new system. Then choose an EMR that has been specifically designed to accommodate the workflows unique to behavioral healthcare. Reason 2. Worry that staff productivity and morale will suffer during and after the transition. In some cases, a switch is embraced by staff, especially those burdened with an out-of-date, dysfunctional system. A glitchy legacy EMR can cause more dissatisfaction and turnover than the transition that replaces it. Reason 3. Concern about cybersecurity during and after the transition. The safety of patient data is sacrosanct, and HIPAA violations are costly mistakes no organization wants to repeat. Behave Health is invested in safeguarding PHI and maintaining patient privacy during all phases of the transition. Reason 4. Not wanting to hire temporary staff to handle the work of switching. Behave Health makes transition support a top priority, a dedicated liaison for help requests, plus free staff training on the software. The help desk is always there if you need guidance, so you don't have to build a temporary transition team. The more complicated a system is, the steeper the learning curve. So Behave Health whittled down the bloat to what behavioral health organizations actually need. Fine-tuning the system makes it easy to find what you need when you need it, quickly and easily. The user interface has the look and feel of a sleek modern app, designed to be extremely easy to use. An easy-to-use EMR cuts down both transition time and training needs. It just works. The all-in-one EHR is designed to put the operational pieces of a treatment center in one place instead of scattered across systems. Clinical documentation, administration, staff, and admissions are designed to live together in one platform. Alumni, residents, and treatment plans are part of the same all-in-one system. Billing and insurance authorizations are at your fingertips alongside the rest of your operations. Stop letting a glitchy legacy EHR cost you staff and time. Start a free trial and see the all-in-one platform at behavehealth.com. See the all-in-one behavioral health platform and the transition support behind it at behavehealth.com.